Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello. And thank you again for tuning in for another podcast episode of the Wellness Optimizing Warrior MD. We are at the beginning of 2024, and I do want to start this episode by thanking you, my faithful audience members, for choosing and dedicating the time to listen to these podcast episodes. I do hope that you find useful information and valuable educational material to help you with your health choices. And I am excited about where the podcast is going to go in 2024. So please stay tuned. I wanted to start the 2024 episodes with a quick discussion about what to look for in a doctor and how to choose a doctor or a medical practice. This topic came in response to a suggestion given by one of my business consultants. It seems like an interesting topic, something that's very nebulous, as a lot of people don't know how to choose a physician. And what should you look for and what should you think it's valuable when you actually choose a doctor or a medical practice? What is the reason that you should choose a specific type of doctor or medical practice? And again, many ask this question as they express their frustration at navigating the medical system and identifying a type of doctor or a type of provider that would best suit their needs. First of all, you should know that there are a lot of choices and options out there as far as choosing a medical doctor or a different kind of provider other than a medical doctor. And the first thing you need to know is what is the reason you want to see that provider for. Let me give you an example. A few years back, I came back on the trip from overseas and I was carrying a very heavy backpack. I carried it on my right shoulder and I didn't realize it's going to impact my body. So I woke up the next day and my shoulder hurt terribly. And I realized something's wrong. I couldn't even drive because moving the wheel with my hand really hurt my shoulder. So I was like, oh my God, I got to do surgery. I got to take care of patients. How am I going to move and do what I need to do? So my first thought was, who do I go to help me figure out what was going on? And of course, the first thing is, well, I got a shoulder problem. Should I go to see an orthopedic doctor? I'm like, well, orthopedic doctors just want an x-ray. They want to operate. And I really felt that this is a soft tissue, some kind of injury or strain on my body. And I didn't really make the connection with the heavy backpack. So I figured, well, why don't I try a chiropractor? So I actually searched for the best reviewed chiropractor in the area and made an appointment, had a consultation. He did some x-ray in the office, I believe, and took a look, said there's nothing wrong with your joint, examined me and had me do some movement and said there's something wrong with your muscles and you have a pectoralis minor strain. He says, how do you think you did it? And I said, well, I carried a heavy backpack on my right shoulder. He says, well, that would do it. Long story short, he gave me some exercises. At the end of that day, my pain had improved by 50%. And I'm not one of those people that pops pills and does ibuprofen and Celebrex and heating pad and cooling pad and wait for the pain to go away. I want to know what the problem is. I'm a problem solver. So he told me what the problem is, how to fix it. I stopped doing all my yoga because I couldn't really lift my arm above my head. To be honest with you, shoulders are complicated and it did take me a very long time to recover. So I was 50% better within a day. I was actually 90% better within 3 to 4 months, and it took me a year to get to 100% better. And this is a small pectoralis minor strain. Again, shoulder is complicated. There's a very important group of muscles. We're not going to get into it. But you want to have a little bit of understanding of what the problem is and who is the best person that is going to solve your problem. I did do some follow-up with the chiropractor. Obviously, he had me come to his office and do things twice a week. Luckily, he took my insurance, and I've actually referred him many patients since, and he's a great person here in Thousand Oaks. So long story short, I did use my medical knowledge and what I knew about the human body to diagnose and to understand this is a soft tissue problem. Who do I see? Well, let me try a chiropractor first, because orthopedic surgeons, they just want to operate, really. So I didn't feel that this was an operation issue. Even if it was a torn muscle, I really wanted to resolve it holistically first. Long story short, you want to understand what the problem is. And sometimes as a patient that doesn't know a whole lot about the human body, you might not know how to choose the right doctor or where to go to. That is where your first person to go to would be your GP or your family doctor. And that's why having a valuable family care doctor on your team that cares about you, that knows you, that you can call for anything at any time and say, hey, I have this problem. Who do I see? And you can get advice. That would be extremely valuable. So first of all, how do you know how to choose someone? Identify the reason. And if you are not sure what is the problem or how do you fix that problem, see your first line care. So see your first line doctor and ask for advice and where to go. Now, let's talk a little bit about you don't have a specific problem. You just want a wellness check. If it's a wellness check and you expect more than a cursory 5 to 10 minute visit, then you need to look for someone who provides a comprehensive wellness check. These appointments would usually last at least 30 minutes if it is a real wellness visit. And if it is a non-wellness visit, but it's a focused multi-problem visit, it can take as long as 1 hour. When you make the appointment to see the doctor, one of the first things you might need to ask is how much time can I expect to spend with a doctor during the visit, realistically? And this is something patients never think of when they make the appointment. And they make the appointment, and the appointment is set in the calendar as a follow-up. And then the doctor sees the patient, says, okay, it's going to be a 10, 15-minute follow-up. In reality, the patient has a bunch of problems. And now it's clear that the patient expects a 30-minute visit when you only have a 10 to 15-minute time allotted for it. As a patient, I think it's your responsibility to think a little bit about what do you want to get out of the visit and how much time do you feel you need with the doctor, and you need to verbalize that with the front office when you make the appointment. So again, ask the question when you make the appointment and you tell the hopefully knowledgeable front office assistant, this is what you need the appointment for. Ask them, how much time am I going to get realistically? If you're told, well, we're going to give you a 15-minute appointment, that means you will likely spend less than 10 minutes with the doctor. If you are told that the doctor will spend 30 minutes with you because you're a new patient and we dedicate more time to the new patients, that might still mean less than 15 minutes in a real medical practice that's very busy and seeing a lot of patients. I personally feel that the time spent with patients is absolutely critical, especially when you establish care with a new patient. You need, as a physician, to achieve a couple of very important things. Number one, you need to understand the client and what they want. And sometimes I call patients clients and sometimes I call them patients, but it's the same thing. And in order to get that, you need something very, very important. And that is time. So let's talk about some of the things that you need as a patient. Number one, you need time. It's the time that the doctor will allow you, the client or the patient, to help him or her, your doctor, would help them better understand and more accurately resolve the problem that you have. Number two, the doctor needs to listen to all the information that is provided by you, the patient, to help him or her solve your specific medical puzzle or medical problem that will be confronting the doctor. For that, it means that the doctor needs to allow you, the patient, the time to talk, because we, the physicians, need to gather all the information that we need to make a determination. It is impossible to make a decision, reach a determination, or find a solution regarding medical management if we don't understand the problem. And we can't understand the problem if we don't talk to you, the client. So time is of the essence. And I'll keep coming back to that. Number 3, the doctor needs to listen. And also, in order to listen, it needs to have some patience. The truth of the matter, as physicians, we expect to process information a certain way. And we're used to processing super high level, very fast information very quickly and very efficiently. We read a lot, we learned a lot in our lives. However, as physicians, I think one of our limitations is that we do not have the patience that we require at all times, as we should, because the truth of the matter is that our patients are not information spewing machines. In my experience, the patients would rather tell us a story, which sometimes will get convoluted, off track. So we gently need to remind them and bring them back in to talk about the problem at hand. But we do need to be endowed and have this talent of listening with patience, which in our busy world and the way businesses and medical practices are run, it's not always available. Sometimes we are running out of patience and we might be rushed. And a lot of times patients do feel that from their doctors. Number 4, one of the things that I believe a physician should have for their clients and patients is understanding and empathy. It is not unusual during the first appointment that patients often get very emotional. Many clients, especially women, break down and cry, overwhelmed a lot of the times by the enormity of this medical burden that they've been carrying on their shoulders, unfortunately unassisted and unhelped by previous physicians. At that point, you really need to understand, slow down, and take a couple of extra minutes to reassure them that, hey, I'm here for you. I will help you. And it's easy to skip over that if we're super busy. Finding a doctor who has those couple of things that I mentioned gives you the time for listening, the patience, the understanding, and the empathy. That type of doctor would be extremely valuable. And you really should look for someone like that. And the truth of the matter is you might not know if you found that person until you have a face-to-face conversation or a face-to-face consultation, because that is the only way you're going to find out if these 4 qualities or features would be available to you from that physician until you meet them. Coming back to the most important thing that you need from your doctor as a patient is time. I really believe our medical system has a big problem, and it's really focused on being more and more efficient, seeing more and more patients. The truth of the matter is, the more people we are going to see, the less time we are going to spend with them. And we need time to spend with our clients. We need time to understand them. We need time to answer their questions. We need time to take care of them. And as a patient, you need time to tell your story. You need time for the doctor to listen to you. And again, time and patience go hand in hand. And if there is no time allowed to make a connection between the doctor and the patient, there probably will be no understanding or empathy felt by the doctor. If you felt that your doctor was kind of cold and rushed and not empathetic or understanding, it's probably because he or she did not have enough time to spend with you and give you the full understanding and empathy that they are capable of, because there's no time for that. But you, the client and the patient, will need time to have the doctor ask you questions to better guide this exchange of information between you, the patient, and themselves, the doctor. You need time that the doctor has to provide you answers to your questions. And you need time to be allowed to ask the questions you need to ask. You also need time for the doctor to discuss the treatment options very clearly. You need time to have them explain to you, and you need time to have the questions about these treatment options answered in order for you to make a decision. And sometimes patients are overwhelmed with the amount of information that's presented, then they might not be able to make a decision right then and there. And that is okay. the doctor who forces you to make a decision right then and there, it's probably not a good fit for you if you're not ready. But the doctor who says, okay, you know what? I provided a lot of information. You might need to take some time to think about what is the best option for you, and then come back and let's talk about this next week or in a couple of days. Then you know you have a winner. Now, this brings us to the topic of time and how it is extremely precious. And in today's day and age, we are bombarded by a huge amount of digital information coming at us in all possible forms. So it is so easily to get distracted and not focus on real facts and what actually matters. So you might find out after the visit that you had questions that you did not ask. So here, time is of the essence again. You need time to be able to interact with the medical staff office, to perhaps relay your questions back to the doctor, and for the doctor to relay some answers back to you through the medical staff. So time spent in engaging with a medical staff office, a supportive staff office, it's also of the essence. And the way that type of interaction occurs is also very valuable in determining what kind of relationship you're going to have with that medical practice. So again, time is very precious. You should probably be able to tell a lot based on how much time the doctor spends with you during their visit and how much time their staff, their medical practice staff, will spend afterwards answering your questions or taking care of your specific needs. To recap, the one thing you need to look for when you make an appointment, when you evaluate a doctor or a practice, is how much time do you get from the doctor and how much time do you get from their support staff. And that will tell you right then and there what will be the quality of care that you will receive during your specific medical journey with that practice. Let me move on to another very important quality that I think you need to look for in a medical provider or medical practice. In my opinion, and supported by many others I queried about this topic, the most important thing that patients want from a doctor or a medical practice is the versatility and the abundance of knowledge, a broad education of both the provider that you are going to see and who's going to take care of you, and as well the surrounding medical personnel. This is a top quality to look for. And sometimes you can tell if a doctor has great knowledge, if she or he will openly answer your questions, will provide lots of information, sometimes an overwhelming amount of information, maybe too much for you to process. But sometimes you can tell based on their resume or their previous education. And here's one of my points of view. This is very personal, but think about this and it might be interesting to you and it's very unusual on how you can evaluate a doctor. But if you find a doctor who, after finishing medical school and residency and has been in practice for a while, if he or she decides to take it upon himself or herself to broaden their education with additional training, with training that is undertaken at their own personal time and expense to get additional certification in anti-aging, in comprehensive wellness, in integrative medicine, in bioidentical hormone replacement, then you know you have a good one there. In my opinion, and this is again my personal opinion, a medical provider who practices the same type of medicine year after year, doing the bare minimum to keep up the certification, maybe participating in what we physicians call continuing medical education online or CMEs, maybe going to one conference or two conferences a year max, and that's because it needs to be at a good, nice location, so you also combine it with some vacation with the family. That is not the type of provider that will keep up with the fast-paced, extraordinary advances that are being made in medicine nowadays. On the other hand, a physician that belongs to an association like the Institute of Functional Medicine, the American Academy of Anti-Aging, the Age Management Medicine Group, etc., is a physician that likely is well-trained and up-to-date with the latest and the greatest. Now, those organizations I just mentioned, they're just a few that come to mind right now. There are many more out there. But again, if you find a doctor who is conventional medicine trained, but on top of that training, she or he decides they want to pursue additional and very likely very expensive training in matters of integrative health, in matters of anti-aging, in matters of bioidentical hormone replacement, in matters of thyroid management, adrenal fatigue management, IV vitamin therapy, etc., then understand that such a physician provider will likely be a wealth of information and will have a lot of up-to-date techniques, technologies, strategies, information regarding a variety of treatments and technologies and alternative modalities that you will not hear and you will not have offered at many and likely at the majority of other physicians. Now, most of these physicians are also focused on wellness and maintaining wellness rather than focused on treating disease. It doesn't mean they don't treat disease. Obviously, they do. But the ideal type of client and patient for these practices are people who really want to fix the problem and then avoid getting into the same problem again, maintaining the benefits of what fixing the problem did for them. So basically, this type of patient or client wants to invest in wellness rather than wait for disease. And then if you wait for disease, then you have to invest in fixing the disease. Then you just go back to your previous lifestyle that caused or contributed to the medical condition. And then you only worry about it if it becomes a problem again. It's a bad approach. And of course, as physicians, we will still take care of you and we will still help you, but it's probably not going to serve you if that's what you expect to get from the medical practice. You're not going to get the maximum benefit. Let me take a little detour here and vent a little, because as a physician, I am very frustrated with how insignificantly little most of the other physicians that are conventional medicine trained are preoccupied or equipped to deal with or address wellness. We have a mindset as conventional medicine trained physicians on just focusing on disease instead of wellness. And this is a terrible way to look at the health in general. And please remember this, and I've heard it said by multiple people in many different circumstances, health is wealth. And that is true. And sometimes you don't realize what you have until you lose it. You need to focus on wellness and health because that's where the true optimal well-being will come from. Let me put it simply. If you think about, okay, I'm going to make an appointment about a wellness check, but your wellness check, instead of telling the physician, hey, I feel great and I want to continue feeling great. Can we run some tests? Can we talk about my diet and my exercise? Am I doing the right thing? Instead of that, if your wellness check is focused on a long litany of problems like fatigue, poor mood, digestive issues, I have focus and sleep issues, joint pain, irregular periods, I'm aging, my skin is wrinkly, my hair is falling off, or I have pain everywhere and stiffness, that will no longer be a wellness visit. Wellness is about prevention. It's about investing in your health rather than just squandering away all your wellness and waiting until you have a problem that is really bad and is very serious and then decide to do something about it. Again, I talked about time and I talked about how valuable time is. So judge the amount of time a physician gives you on how you're going to choose a medical practice. If a physician gives you the time that you need and spends a lot of time with you, and if the medical practice answers your calls, gets back to you and provides all the information you need and has the answer to all your questions, then that's a relationship you want to nourish and you want to continue to maintain. Also, remember, wellness is different than a disease state. And in the next episode, what I'd like to do is talk more about a wellness check versus a disease focus appointment and how they're very different and give you some examples. So for the time being, I'm going to say goodbye here, and hopefully I provided some valuable information to you in how you should choose a doctor and a physician in today's modern world where we all run around from doctor to doctor, from patient to patient, and we don't have enough time for anything. So thank you for listening, and I will see you next week. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that. Or wow, I'd like to know more. So keep listening and I'll keep talking.